my talk was really sort of based on a paper that I led as part of the upcoming Lancet series on obesity, which will be coming out in early 2015. The impetus for this, really is based on the observation that, there are all these policy recommendations that are out there. Most of the leading organizations seem to have reached a certain degree of agreement as to what are the policy prescriptions that public health really needs to push for. Yet, there's actually been very limited successful policy adoption around the world. And so the question then is, well, why is that the case? So we took on this task that turned out to be a much arduous journey than previously anticipated to look at different examples around the world, particularly through the lens of political science, on how policies are adopted and implemented in various fields. In fact, we looked at well beyond obesity and nutrition, and begin to kind of crystallize some of the key lessons, which we think in our paper could help take obesity prevention efforts to the next level. So the question really is, how do we move from the what's in the hows? Not only to ensure policy adoption, but to ensure that when policies are implemented, that people, the stakeholders, the public, react to those policies most optimally. So I'll primarily use the three predominant political science frameworks to argue the case, but also couch the various examples I'm going to give on the broader system science framework, because I actually think that the arguments are quite coherent across the political science models and what we in the field have begun to appreciate through system science thinking. The first model is the multiple streams framework from Keenan, and which really talks about the problem stream, the politics stream, and the policy stream. And in obesity prevention, there's obviously improvement that can be made across all three streams. But I think that for the most part, we have been focused on the problem stream, and maybe in the last 10, 15 years, more so on the policy stream. But I would argue that very little effort has been done around the politics stream. But even in the problem and policy stream, there's clearly improvements that can be made. For example, how we actually frame obesity, we still haven't quite figured that out. The multiple streams framework has actually been used to a great extent to understand, analyze the healthy cities movement around the world. Much of the analysis to date has been done on the European Healthy Cities Network. And there are a lot of lessons that have been drawn through this sort of qualitative, well, really mixed methods, but a lot of qualitative analysis of what really makes a healthy cities work. And so one of the really key lessons that jumped out from the series of analysis was really the important role of social entrepreneurs or change agents in each city. And that, and it's not only about cultivating the change agents, but it's really about also the placement, the distribution of change agents across different sectors, and organizing those change agents or social entrepreneurs into learning networks. Not surprisingly, cities that have performed better in health over time are the ones that have actually institutionalized these change agents. But what's really key here, though, is that, in typical obesity research fashion, we kind of expect grant applications to come into a funding agency, describing that these change agents already exist. But in the Healthy Cities movement experience, we learned that building capacity of these change agents really require much a priori strategy, a great deal of investment, and it takes time. And so this is consistent with sort of the whole building trust discussion that we were having. You know, we can't just expect that trust gets built overnight. It takes a systematic effort, investment, and it takes time. So I think it begins to shed light on you know, some new directions, new opportunities that we as a field and the funding agencies in the field can begin to think about in terms of, you know, whether we are allocating our resources necessarily in all the right places. So the second political science framework that we have found to be useful is called the punctuated equilibrium framework. And it works not you know, at the exclusion of other frameworks, but really in concert. So in the case of Slovenia, and there was a nice article published in 2012 about Slovenia's experience around building national food and nutrition strategy. The punctuating event actually wasn't really one, you know, event overnight. It was actually a decade-long anticipation of accession to the European Union. And so Slovenia was successfully became a member of the EU back in 2004. But the efforts around building this strategy actually started at least a decade before that. And what was really interesting is that even back then, so this would be like in the early 1990s, there was a concerted effort to focus and align actors as well as strategies that fall very nicely into actually the three streams of Kingdon's multiple streams framework. So on the problem identification side, there were analysts that were organized to provide the data and to communicate the data to different stakeholders, including policymakers. On the policy solution side, it wasn't just about, you know, getting the national academics together, but actually strategically linking the national actors and leaders with international groups, seeking out policy solutions and advice and recommendations from around the world, much like what we're doing today, looking at global efforts that could benefit obesity prevention in the US, but also to get outside actors and outside organizations to come into Slovenia to help make the case. And then on the political opportunity side, there were these policy entrepreneurs who were tasked to take advantage of this political change, this window of opportunity created by this anticipated punctuated event in terms of EU accession. But very importantly, these people were tasked to think beyond nutrition. So much of what Slovenia was dealing with was actually structural and systematic reorganization of its finances, its you know, public and private investment in, you know, the major driving forces behind its economy. And so there were all these much bigger issues related to trade and related to how Slovenia as a country could be competitive in light of you know, the competitive edge that some of the neighboring countries were having, like Hungary, Slovakia, et cetera. And so they actually systematically developed and went through the process, this internal negotiation for at least a decade to develop strategies, national strategies that aimed at making Slovenia competitive or ensuring that Slovenia will continue to be competitive or become more competitive after EU accession. And it is in that context that the national nutrition strategy was actually developed. So the lesson here is that, even in this case, although the topic of focus is on food and nutrition, how the policy was actually adopted and coordinated was really part of a bigger picture. And so, oh, what happened? There we go. Okay, so moving along, the third political science framework that I want to highlight is the Advocacy Coalition framework. And we heard so much about Mexico today. It's the shining light in contemporary discourse. And, but I want to specifically focus on the Mexican Alliance for Dietary Health, because I think it's a really good example of cross-sectoral commitment and partnership to demand societal and policy change. So what I have learned in studying what's happening in Mexico is that this alliance has been really instrumental in 4 fundamental ways. First, it's helped create a unified voice. Second, it has actually developed this platform to help streamline the strategies. And in doing so, it helps engage the policymakers, issue experts, as well as the public. And then third, it helped frame the issue, using a common frame, common messaging, or set of messages. And in this case, access to health and nutrition is framed as a human rights issue. And then fourth, just framing the issue is not sufficient, and people behind this clearly knew this. So the Alliance have began launching a series of very intensive PR campaigns. And one example was the junk food cartel, which I thought was very, very powerful, using very popular cartoon characters that all parents and kids could recognize, and putting them in the context of a cartel, which of course has great sort of political undertones in the context of Mexico. So I thought that was really, really smart marketing. And collectively, these 4 strategies or achievements helped elevate public protests against rights violation, resulting in significant media coverage, which in turn further mobilized the stakeholders. And then, of course, we know the success in getting the soda and junk food taxes adopted and implemented.